Good afternoon, everyone. Bonjour à tous et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de la COVID-19. My name is Sébastien Tremblay, and I will be your moderator. Je m'appelle Sébastien Tremblay et je serai le modérateur de ce point de presse. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser une question. Today, we'll be hearing remarks from Councillor Keith Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, Président du Conseil de santé d'Ottawa, followed by Anthony DeMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available from questions from the media following the statements, we also have. Disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Trevor Arneson, Associate Medical Officer of Health, Ottawa Public Health, médecin adjoint en santé publique Ottawa. After we hear from the panelists, we will take questions from the media. We will begin now with remarks by Councillor Keith Eglai, Chair, Ottawa Public Health Board, le conseiller Keith Eglai, Président du Conseil de santé d'Ottawa.
Thank you very much and good afternoon, everybody. Bonjour, Kwe. Thank you all for participating in today's media availability. I'm joined by Mr. Tony DeMonte, General Manager, Emergency Protective Services, who will provide an update on the local COVID-19 vaccine rollout, and by Dr. Vera Etches, our Medical Officer of Health, who will be providing an update on the local COVID-19 situation. As you will hear from Mr. DeMonte and Dr. Etches, the vaccine rollout is being accelerated as a result of recent federal and provincial announcements. And this is great news. It's what we've been waiting for, and I want to thank Mr. DeMonte and Dr. Etches and their teams for their exceptional work to date. I also want to thank residents for their patience. This is a huge undertaking, and we're not out of the woods yet. Until we can get enough people vaccinated, it's important that everyone continue to follow the public health guidelines. Before I turn it over to Mr. DeMonte and Dr. Etches, I did want to address one thing that was recently brought to my attention. As we all know, COVID-19 is ever present in our community. As a result, Ottawa Public Health's case and contact management team continues to follow up with every resident who tests positive for COVID-19 to identify locations where they may have visited while contagious, to obtain a list of their close contacts, and to provide information on measures needed to prevent any further spread of infection. The next step is to notify residents who are deemed to be a high-risk close contact of a confirmed case to provide them with information based on their individual level of risk. The first objective of case and contact management is to do everything possible to prevent further transmission of the COVID virus in our community. Beyond that, case managers are there to ensure that individuals who have tested positive have the information and supports that they need to self-isolate while they rest and recover. I know that this is not the norm, but we are hearing some reports of our case and contact management team encountering resistance, and in some instances being subjected to abusive behavior. Given the objectives of case and contact management and the importance of this work, I am asking those who have been directly affected by COVID-19, either because they or a loved one has tested positive, or because they have been identified as a high-risk close contact, to please be kind to our case managers as they work hard to navigate the unique circumstances of each individual who tests positive and those of their close contacts in order to provide you and your loved ones with the best advice to keep you as safe and as healthy as possible. This work is important to the community as a whole. OPH staff are there for you, and they've been working tirelessly throughout the pandemic. Please treat them with kindness, patience, and respect as they carry out their duties. We know that the past year has been difficult and has impacted all of us differently. We understand that. We also understand it's okay not to be okay. If you or someone you know is struggling with their mental health, please reach out. Speak to someone today. You can find local mental health and substance use resources at ottawapublichealth.ca/COVID mental health. As we approach March 11th, the one-year anniversary of the WHO declaring COVID-19 a global pandemic, I want to thank the community for coming together and supporting one another, and for continuing to follow public health guidelines to stop COVID-19 transmission in our community. It has been a long road, but we are getting closer to the end of it, and we could not have made this progress without the cooperation and collaboration of the residents of Ottawa. So please hang in there a while longer. We will succeed in pushing back against COVID in our community. Thank you. Merci. Miigwech.
Thank you, Councillor Eglai. We will now hear remarks from Anthony Damonte.
Thank you, and good afternoon. Bon après-midi tout le monde. My update to everyone thank you for everyone joining us today. Je vous remercie toutes de nous avoir joints aujourd'hui. We made a commitment at the beginning of the vaccine rollout to open vaccination clinics as soon as we had more vaccine supply. And I'm pleased to say today that we're delivering on this commitment. This past week alone, we've administered over 12,700 doses. Although we don't expect the provincial booking system to be up and running until next week, we are continuing to move forward nonetheless in Ottawa. And as we are doing so, we're doing so to protect our population that's most at highest risk. Starting Wednesday, residents 90 years of age and older from all areas of the city will be able to book a COVID-19 vaccine appointment. À partir de mercredi, les résidents âgés de 80 ans et plus de tous les quartiers de la ville pourront prendre rendez-vous par téléphone pour recevoir le vaccin contre la COVID-19. These are phone registration opportunities, so please don't call before Wednesday. We will not be able to book you until then. Appointments will begin on Friday, March 12th at the Nepean Sportsplex Community Vaccination Clinic. We estimate that there are approximately 6,000 eligible residents in the 90-plus age group. We continue to have limited supply, and we need to be able to manage the number of people calling the vaccine booking line. So we are limiting our expansion to this age group at this time. I would like to remind residents that it might take some time to book your appointment, so please be patient. Je tiens à rappeler aux résidents que peut-être ils seraient pris au rendez-vous, peut-être en certain temps, ils doivent être donc patients. In addition, the booking line is receiving a significant number of calls from people who are not yet eligible to book for an appointment. We are asking that everyone please visit ottawapublichealth.ca to assess Ottawa Public Health COVID-19 vaccine eligibility screening tool before calling the booking line and determine if you are eligible to receive a vaccine at this time. I would also like to point out that this isn't a one-time opportunity for our 90-plus residents. Individuals in this age group will be able to continue their COVID-19 vaccine and receive one going forward. For those who would prefer to book appointments online, as I mentioned earlier, we expect the provincial online booking system to be ready next week. So there will be plenty of opportunity to book your appointment that way as well. We are currently working on plans to open up additional community clinics once the provincial booking system is launched. Nous élaborons actuellement des plans en vue d'ouvrir d'autres cliniques communautaires après le lancement du système provincial de réservation. Also, starting Wednesday, the next phase of healthcare workers, all patient healthcare workers, patient-facing healthcare workers, such as doctors, nurses, dentists, midwives, physiotherapists, any other healthcare worker working in patient-facing role will be able to register at ottawapublichealth.ca or to pre-register for a vaccine appointment. These pre-registration individuals will receive an email with the details of their appointment when their time for vaccination sequencing is up. As many of you are aware, our pop-up vaccination clinics opened this past Friday. These pop-up clinics have been a success, and the uptake of eligible residents receiving their vaccine has exceeded our expectations. I want to extend a big thank you to all the staff for their exceptional work. This certainly was no small feat getting these clinics organized and up and running. Je tiens à remercier chaleureusement tout le personnel pour leur travail exceptionnel. Il n'a certainement pas été facile d'organiser et de mettre en pied ces cliniques. Yesterday, we announced that residents born in or before 1941 or adult recipients of chronic home care and who live in the following communities are eligible to receive COVID-19 vaccine: Bayshore Belltown, Carlson Grove, Carlson Meadows, Greenboro East, Hawthorne Meadows, Hunt Club East, Western Community, Hunt Club Park, Lower Town, Manor Park, Overbrook MacArthur, Parkwood Hills, Sheffield Glen, Stewart Farm, Vanier North, and Vanier South. And so pop-up clinics are operating from the following locations for these neighborhoods: Albion Hetherington Recreation Center, the AMA Community Center, Canterbury Recreation Complex, Centre Pauline Charon, and Emerald Plaza branch of the Ottawa Public Library, Greenboro Community Center, Ottawa City Hall, Overbrook Community Center, Pat Clark Community Center, Ron Cobus Lakeside Center, St. Laurent Complex, and the Sawmill Creek Pool and Community Center. Again, I want to remind everyone that this situation is changing constantly. We understand that this can be challenging to keep you all in all of this information. Encore une fois, je tiens à rappeler que cette situation est en constante évolution. Nous comprenons qu'il peut être difficile à tenir au courant tous les renseignements. But as we are headed in the right direction. As you may recall, the rollout began in Ottawa on December 15th when the first vaccine was administered at the Ottawa Hospital Clinic. Since that time, all 28 long-term care homes have received their first and second dose of vaccine. Second dose offers are currently underway for the residents of the 82 designated retirement homes. These highest risk residents were vaccinated on site by medical staff or more often by our mobile vaccination teams comprised of staff from Ottawa Public Health, the Ottawa Paramedic Service, local hospitals, community physicians, and other partners. A true embodiment of one city and one team. In addition, the highest priority healthcare workers, as defined by the province, have received their first dose offers through the Ottawa Hospital Clinic, and focus is now on the very high priority healthcare workers. Vaccination of Indigenous older adults and other congregate care setting for seniors, including shelters, is ongoing. La vaccination des Autochtones aînés et les vaccinations d'autres établissements de soins collectifs pour des personnes âgées, y compris les refuges, sont également en cours. To date, more than 63,500 doses of vaccines have been administered locally. Right now, our focus is on vaccinating our residents who are at the highest risk. Then we will gradually start to vaccinate more and more people. Finally, a reminder that even though we have started the vaccination process, it is still critical that everyone, including those who have already been vaccinated with their first vaccination, continue to follow public health guidelines. Enfin, je vous rappelle que même si nous avons entamé le processus de vaccination, il est toujours essentiel que tout le monde, y compris ceux qui ont déjà reçu leur première dose de vaccin, continue à suivre les directives de la santé publique. Please continue to wear a mask in public, wash your hands thoroughly, practice physical distancing, and only go out in public for essentials, and stay at home if you're feeling unwell. Although we're not through this yet, we are definitely making progress, and we will continue down this path. Thank you very much. Merci beaucoup.
Thank you, Mr. DeMonte. We will now hear from Dr. Vera Etches.
We are approaching the 1-year mark from when we announced the first person to test positive for COVID-19 in Ottawa, and from when the World Health Organization declared a pandemic. This has been the most challenging year of many of our lives, and certainly of my career and my personal life. But every day I am more and more amazed at the extraordinary way people have adapted to the circumstances, by the resilience and the bravery and the strength in our community. Together, we are forging ahead. And while there are many months of hard work ahead of us, we have turned a corner with the progress we've made on vaccines. Et bien qu'il nous reste encore plusieurs mois de travail difficiles à accomplir, nous avons pris un tournant avec le progrès réalisé avec les vaccins. And as Mr. DeMonte said, starting Wednesday, March 10th, patient-facing healthcare workers in the provincial category, which is now eligible, very high priority. That includes doctors and dentists and nurse practitioners, midwives, physiotherapists. People will be able to Visit ottawapublichealth.ca to pre-register for a vaccination appointment. Once the provincial booking system is stood up, this pre-registration system will link in the background to the provincial booking system and will notify healthcare workers of how to book their specific appointment time for the vaccination. Until then, some healthcare workers who are pre-registering as the capacity allows, they'll be contacted through the usual booking system by our hospital partners using the pre-registration information submitted. So I want to thank all healthcare workers for your selfless and courageous work during this pandemic. As a family physician colleague, I know the care and compassion you bring to your patients, and thoughts of how you contribute to the whole community's well-being are always in our minds. You are heroes for what you do. Thank you for keeping our community safe during this pandemic and safer. And I want to thank you for your patience and for maintaining professionalism through such a challenging time. Je tiens à remercier tous les professionnels de la santé pour leur travail dévoué et courageux pendant la pandémie. Merci d'avoir assuré la sécurité de notre communauté pendant cette pandémie. I'll also provide a quick reminder to Indigenous community members that vaccinations are being provided by the Wabano Center for First Nations, Inuit, and Métis community members 50 years of age and older at the Saint Laurent Complex vaccination site. And appointments can be booked by calling Ottawa Public Health at 613-691-5505. The Akausavik Family Medical Center is also vaccinating Inuit individuals 50 years of age and older. Please call the Akausavik Family Health Team at 613-740-0999 to book an appointment at this site. And frontline staff from Indigenous serving community agencies delivering any type of health service can book an appointment to get vaccinated by calling either Akausavik or Ottawa Public Health to book an appointment at one of these two clinics. So the latest monitoring indicators about what's going on with COVID in our community, they show that while the number of people testing positive for COVID-19 is relatively stable, we have had a sharp rise of COVID in our wastewater. History's shown that whenever the wastewater indicators go up, the number of people who test positive follows suit. Hospitalizations are back up, and so is the percent of people testing positive. So we're seeing new outbreaks every day, and our rate of COVID-19 is now at 37 per 100,000 people. It's not far from the threshold of red, which is 40. And so while nearly half of the people testing positive for COVID-19 are household contacts, it's important to note that we are seeing more transmission occurring in private gatherings and among sports teams, including sports teams for middle-aged and older adults. Alors que près de la moitié des personnes testées positives pour COVID-19 sont des contacts familiaux, nous constatons une augmentation de la transmission lors de rencontres privées et parmi les équipes sportives, y compris les équipes sportives d'âge moyen et de personnes âgées. Similar to what we saw in the fall, transmission is happening in change rooms, from carpooling, pickup games without readily available contact tracing information, and social activities before and after sports. And although training is still permitted, team sports and activities are considered high risk. So it is important to use those core principles of mask wearing, physical distancing, hand washing, and staying home when sick to reduce transmission of the virus. It can be incredibly difficult, and for some more than others, to self-isolate, especially for those who have families. So I want to remind residents there are resources to help you. The city's Human Needs Task Force was implemented as part of the city's emergency management plan and an emergency response to COVID-19 to ensure that we are responsive to the emerging needs of the community. Sometimes it's difficult for those in crisis to connect themselves, so don't hesitate to reach out for help on someone else's behalf. Additionally, if you're unable to self-isolate from others at home, Ottawa has a voluntary isolation center for people who do not have access to an adequate shelter or cannot self-isolate safely in their own homes. There are no costs to individuals who need to stay at the center, and it's an opportunity for people to rest and recover without fear or anxiety of transmitting the virus to their family, their loved ones, their roommates, and those they live with. Voluntary isolation is a proven way to reduce the risk of spreading the virus among household contacts. Si vous ne pouvez pas vous isoler des autres dans votre foyer, Ottawa dispose d'un centre d'isolement volontaire pour les personnes qui n'ont pas accès à un abri adéquat ou qui ne peuvent pas s'isoler en toute sécurité dans leur propre foyer. L'isolement volontaire est un moyen éprouvé de contribuer à réduire les risques de propagation du virus parmi les contacts familiaux. So visit ottawapublichealth.ca/self-isolate for more information, including tips on how to isolate safely at home. When it comes to self-isolation, please be kind to our case managers as they work hard to navigate each unique case and each contact circumstances to provide the most responsible advice to keep you and your family safe and healthy. Our case managers and contact tracers are working tirelessly to trace every contact possible to keep schools open and businesses open. They want to give you the best information, resources, and individualized care. And in return, I ask that you show cooperation, patience, and kindness. Nos gestionnaires de cas et nos agents de recherche de contacts travaillent sans relâche pour retrouver tous les contacts possibles, afin d'assurer la sécurité dans les écoles et de maintenir les entreprises ouvertes. Ils veulent vous donner les meilleures informations, ressources et soins personnalisés. En retour, je vous demande de faire preuve de coopération, de patience, et de gentillesse. And near this sad anniversary, I do want to thank the entire Ottawa Public Health team, the city, and healthcare partners who've been working and collaborating at such an impressive level to protect our population. Ottawa Public Health team members are supporting schools, they're building new IT systems, analyzing data, scheduling staff, engaging community leaders, maintaining as much essential public health support as possible to families with young children, addressing mental health and substance use needs, following up on other infectious diseases like hepatitis A and tuberculosis, and forming the official plan to build a healthy city. We're fixing cavities and abscessed teeth, and the list goes on and on. I'm so grateful for the team's dedication and expertise. And I want to thank each and every one of you in Ottawa for everything you've done this past year and continue to do as we brace ourselves for a few more months of hard work and patience. Soon this pandemic will be behind us, and until then, we need to buy time by keeping up with our public health behaviors. Yesterday, I was sitting having my morning tea and I heard birds chirping outside my window. It reminded me spring is just around the corner. And with the spring comes warmer weather, longer days, and for those who might not enjoy winter as much as others, the desire to spend more time outdoors. So I found myself feeling hopeful about that, hopeful for a better summer than the last. Maybe not quite like the summers before COVID just yet, but we will get there. One step, one day, one vaccine at a time. Merci, Miigwech, and thank you.
Thank you, Dr. Etches. I'll now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until invited to ask your question. We'll now start with CBC Ottawa, Stu Mills. Stu?
Hi, thanks very much for taking my question. Good afternoon. I suppose my initial question is about what sort of timeline we might see people in the 70 to 80 age range be offered a vaccination, and when, given that everything else has been kind of moved up on the timeline, when we might see wide open mass vaccination call-outs, when it might be possible for people of any age not yet named in a particular at-risk group to be invited to come for vaccination?
So I'll let Dr. Etches as well chime in on the hierarchy and where her head's at with that. Stu, the challenge we have is always vaccine, right, and the supply. So as you can see, we've been continually pushing forward. We've done in the high risk communities 80 and over, the 21 neighborhoods that have been identified, and that's underway. We identified, about 6,000 people 90 and over, and so we believe we have enough supply to then open up for them. So that's what we've done. So directly to your question, as we get more clarity on the number of vaccine, and I want to tell you it's encouraging, but because we're seeing numbers that are going to increase, and with the changes now that have been identified that we don't do second doses for the vast majority of groups, there are some exceptions that allows us to start our planning. So I don't want to give exact dates, but what I can tell you is we're going to continue to push forward and move as quickly as we can. So as we're finishing up those 21 neighborhoods, now we're doing the 90-year-olds. We're going to move the next phase before 70 that you've talked about. We want to do 80-year-olds across the community as the next phase. And that may require both more vaccine and probably more sites. So we're currently planning for that. And I suspect that Dr. Etches and I will be announcing that in the next little while as we move forward. We're just doing the math now to make sure that we've got what we need to go.
It's true. We have the same information that doses will be increasing in number. And, I think we know this population of people over 80, is about 43,000 people in our community. We've already reached some of that population in long-term care and retirement homes, and now in some neighborhoods. So, I actually think we'll be able to proceed through and reach most of this population relatively quickly once those vaccines start arriving. So after that, it does go down to people under 80 in 5-year increments, so 75 and above and 70. So we're encouraged looking ahead, and I think that the intent is to verify what's arriving and make those announcements as we see we can stand clinics up week by week.
By way of follow-up, I wonder what the policy is for a household where, let's say, the husband is 91 and the wife is 83 and not yet eligible to be vaccinated. What should that couple do?
Well, the clinics for anyone in the whole city over 80 will be open very soon. So if it's easier for the couple to come once to do one trip together, they could wait until the clinics open for anyone over 80 and make an appointment at the same time. Or the person over 90 will be eligible to book into a clinic this Friday, starting to make phone calls for that on Wednesday, tomorrow.
All right, thank you.
Thank you, Stu. We will now move on to City News Ottawa and Eric O'Brien. Eric?
Thank you. Good afternoon, everyone. I guess my first question is probably for Mr. DeMonte. Now that AstraZeneca vaccines are on the way, and they have to go out quickly by April 1st, I think. How many will Ottawa be getting, and what's the plan there? How is it planned to get delivered out in the community?
Yeah, so the preliminary information, again, the province has a lot of the decisions with regards to this. So the preliminary information that we've been given is the AstraZeneca will be distributed as part of the pilot project for the pharmacies in 4 regions in the province that have been identified and announced by the province. So that first batch that we're receiving is going there. I think as the planning team at the provincial level are looking, AstraZeneca and perhaps other vaccines that may be coming online, the Johnson & Johnson vaccine, because they have less problems with regards to storage and the complexity that they have, are probably easier to use either in doctors' offices or pharmacies. and that'll probably be the target for that. So right now, directly to your question, we're not receiving any AstraZeneca. We're going to continue with the Pfizer and the Moderna here in Ottawa, and that's what our planning is doing. The first batch of AstraZeneca that's arriving is going into those pharmacies, and then I suspect as they continue rolling out pharmacies across the province, it'll be going there because it's much easier to maintain and easier to use in that type of environment. And on the other end, our clinics and our hospital partners that have clinics as well too, because of the sophistication that they have, it's easier for us to use the Pfizer and the Moderna. So that seems to be the way things are going to roll out.
All right. Now, just as maybe a follow-up, changing subjects a little bit. For the booking systems itself, and maybe I misunderstood, but did you say that you're opening up to call for bookings to everyone, to every neighborhood as of Wednesday? And how will you deal with the influx of possible calls that you'll be getting?
Yeah, it's a good question. So yeah, two things. As you know, the province, as part of their the rollout strategy for Ontario, is responsible not only to distribute the vaccines, but set the priorities, which they've been setting of the different groups. And as well, the provincial booking and registration system is going to be one provincial system, and that makes a lot of sense because then we know where the product's going, how many people are getting vaccinated, and we have a better understanding provincially. So they're responsible for that. That will only be launched on the 15th. That's the target date. Locally, we identified, and Dr. Etches was quite clear that some of these high-risk groups, and over 90s now, the next high-risk group needs to get vaccinated. We felt that we had vaccine to do that. And so we're going to be doing that without a booking system, for lack of a better term. It's a call center, so you're going to be calling a phone number to book your appointment if you're in that category. And just to clarify for you, as of Wednesday, people 90 years and over, regardless of the neighborhood, anywhere they live in Ottawa, can call the phone number to book an appointment, and they will be allowed to go to our the first mass vaccination site we're setting up just for them at the Nepean Sportsplex. So it is extremely important, if you're not 90 or over, or you're not calling to book an appointment for someone 90 or over, please don't call the line, because we are doing this manually. We're kind of pushing the envelope. We know it's a little clunky and it's not the best model because the provincial system isn't yet up and running, but we didn't want to wait. These are important clients, and these are important residents of our community that need to get vaccinated, and we have the capacity. So we're opening up the Nepean Sportsplex. They can go get vaccinated there. And then when the provincial system comes online, then we'll make other announcements and probably open other clinics. So I hope that answers your question.
Yes, thank you.
Thank you, Eric. We will now move on to CTV Ottawa and Ted Raymond. Ted?
Hi, good afternoon. Thanks for taking my questions. My first question is for Mr. Eglai, and Dr. Etches can chime in on this as well. You mentioned in your opening remarks that some of your case contact management people are facing resistance, abuse. Could you elaborate a little bit on that? Like, what kind of reactions are they getting? How much has this been happening lately? Is this something fairly new that you're seeing?
So what I've heard from senior staff at OPH is that, and by no means is this the norm, but we have had instances where our staff following up on contacts have been hung up on, they've been yelled at, people have threatened. I'm not sure this is a threat, but people have threatened, if they continue to ask them questions, that they're going to go to the media about it. So, I mean, the point I was trying to make, and I think Dr. Etches was trying to make, is the people doing the contact tracing, they're doing this for everybody in the community. They're doing this to make us all aware of where the risks could be, where the less safe spots in the city are, and to follow up on people who may have come in contact with somebody. So all we're asking is, recognize they've got a tough job to do. I know people are afraid and frustrated. And if you got a call like that, that might well make you nervous and upset because you're feeling at risk. But just try and remember that the people on the other end of the phone are simply doing their job, and they're trying to keep people as safe as they can. And they need this information, as Dr. Etch has said, to do things like keep the schools open and activities going in the community that we're relying on. So just asking for people to remember that when you get that call, and just answer the questions as best you can. And in doing that, you're helping everybody around you.
I would add it is a minority, a small minority of the time that people are getting upset with the Ottawa Public Health staff trying to support people to understand how to protect their household and their contacts. We know that sometimes when things escalate to the point of abusive language, it can be a sign that people are struggling and they need more support. And so we do want people to understand, we get that too. This is a difficult time. Many people have had very negative experiences because of COVID-19. And so there are supports available. That's part of what we can do, is connect people to supports. I think internally, our staff are resilient. We have certainly been careful to make sure that they have the support they need when things escalate, and we just can't have an environment where this is something that's tolerated. They're human too, and so all of us, we just want to promote kindness and kind words.
All right, thank you. My next question is for Mr. DeMonte. I'm wondering if you can describe a little bit about the pre-registration for patient-facing healthcare workers, and maybe give us a ballpark in terms of like how long, we have somebody at a birthing center, for example, pre-registers tomorrow. How long would it be before they get the shot?
So two things. So they can. The healthcare workers will be able to go and pre-register on a site, and obviously the pre-registration is going to be asking them, what sector of the healthcare team that they're working in right now. So it's going to go through some screening process there. Then they'll receive an email to communicate with them and book the appointment. Again, it'll vary. As we mentioned, we've got enough vaccines starting to come in. The vast majority of the healthcare workers will be directed for the beginning of this process to the two hospital sites, the Civic and soon to be open, the Queensway Carleton. Later on, as we move forward and we start opening up more sites, then they'll have the options of those sites as well too. Timing, your colleague asked the same question. It's always very difficult as this starts rolling out. What we're doing, as I continue to mention, is execution of this plan is our priority, and we want to push the envelope as quickly as possible. So as much as that we can get in on this large group that's coming next, these important next phase healthcare workers, we're going to be pushing that envelope and trying to get them in as quickly as possible. But I'd rather not give an exact time, because to be candid, I don't have that yet. We're gonna open that up, and we're gonna start pushing the envelope and get as many through as quickly as possible. Is the best answer I can give you today.
And I will just add that this is a population where no list exists yet. So this could be, well over 50,000 people, and the pre-registration system allows us to generate that list to be able to better understand and appreciate the size of this population that we need to allocate vaccine towards. And so you can tell we're doing this concurrently with protecting older adults in the community. So we know we need to continue on with people who are most likely to be hospitalized and even face death from COVID. And so this continues to be a priority, where we're taking the vaccine that arrives and allocating it across all of the phase 1 populations. So I think we'll get a better sense as we see the numbers coming in, who pre-registers in this very high priority category, and as we see the vaccine supplies arising again.
Thank you very much.
Thank you, Ted. On va maintenant à 104.7 Outaouais et Caroline Bertrand. Caroline?
Oui, bonjour tout le monde. Merci beaucoup pour le point de presse. En fait, ma première question concerne les travailleurs de la santé au niveau des foyers de soins de longue durée, des maisons de retraite. Je veux savoir, en fait, quel pourcentage de ces travailleurs-là ont été vaccinés jusqu'à maintenant. Est-ce qu'il y en a, en fait, est-ce qu'il y en a beaucoup qui ont refusé de recevoir le vaccin? C'est une situation qu'on a assez présente ici en Outaouais. Je veux savoir un peu qu'est-ce qui se passe du côté d'Ottawa là-dessus.
Je peux peut-être débuter et laisser la docteure Etchiz parler. Je ne suis pas sûr qu'on a tout l'ensemble d'informations que vous voulez parce que ça va dans le système provincial. L'ensemble des travailleurs qui travaillent dans les soins de centres de longue durée et les foyers les résidences de personnes âgées ont eu l'opportunité, lorsqu'on a passé à travers de ces centres-là, d'être vaccinés. En plus, ils continuent à avoir l'opportunité de se présenter à l'hôpital civique pour un vaccin. Je n'ai pas les numéros. Je ne sais pas si le docteur Etchiz a des chiffres à cet égard-là, parce que comme je vous indique, ça va dans le système provincial de collecte. Donc, on ne sait pas, je ne sais pas, je vais laisser au docteur Etchiz répondre à cette partie de la question.
C'est presque la même. Et aussi, je peux ajouter que nous avons fait un sondage au centre foyer de longue durée pour leur évaluation, le niveau de protection dans leur cadre de travailleurs dans les foyers de soins de longue durée. C'était depuis quelques semaines maintenant, quelques semaines dans le passé que nous avons un numéro, je pense que c'était 58%. C'est presque l'idée de la protection dans les foyers de soins de longue durée. Mais comme M. Demonté a dit, c'est pas exactement le niveau aujourd'hui parce que le nombre de personnes qui continuent de présenter pour la vaccination, ça augmente aussi. Alors, on va faire un sondage avec les foyers de soins de longue durée encore dans l'avenir pour aider avec cette évaluation.
Parfait, merci beaucoup. Ma deuxième question porte un peu sur les sports. Vous avez mentionné que vous remarquez de plus en plus de contamination dans le milieu sportif. En fait, qu'est-ce qui vous inquiète le plus? Une situation qui interpelle parce que Québec va présenter vendredi un plan de déconfinement progressif pour le milieu du sport. Est-ce que vous pensez qu'en Ontario, ça a été trop permissif, trop rapidement? Qu'est-ce qui vous inquiète le plus au niveau de la contamination dans le milieu sportif à Ottawa?
Oui, je voudrais commencer par dire que c'est important d'être actif et je comprends c'est bon d'être actif et aussi on manque le contact avec nos amis, nos voisins, mais avec des activités sportives, c'est possible d'avoir le contact étroit et sans masque. Ça crée des situations où c'est possible d'avoir la transmission de COVID-19 et on voit cette transmission. Et la difficulté, c'est que quand c'est une personne plus âgée, moyen âge, un peu plus, c'est aussi possible d'avoir une maladie, une infection sévère. Il y a des gens dans les hôpitaux dans cette catégorie d'âge et je voudrais éviter cette situation. Alors, c'est possible de réduire le risque. C'est aussi les situations un peu sociales avant et après les activités sportives qui créent le risque. Alors, on peut choisir de aller dans une voiture juste avec les personnes, avec le foyer, les personnes qui habitent dans la même maison et éviter un mélange de gens comme ça. Éviter les repas ensemble, les choses où les personnes sont plus proches, près de 2 mètres, ça crée, c'est les situations comme ça qui créent le risque.
Merci beaucoup.
Merci, Caroline. We will now go to Global Ottawa and Craig Lord. Craig?
Thanks very much. You may have just said a little bit of this in French, but apologies, Dr. Etches. I think in English, I wanted to ask you a little bit about the moving potentially to the red in the near future. You said that the wastewater data that we're seeing suggests we're going to see rising levels of the virus, and we're just on the precipice of the red zone now. So would you support maybe a sort of preemptive move on the color-coded system to get ahead of what you kind of forecast as some rising viral levels in Ottawa?
Thank you. I'm watching this very carefully because if I continue to see the situation where COVID is being transmitted and we see the variants of concern rising, we have higher numbers of variants on the screening test this week, up to 124. It's putting these different variables together that if I see that we're having other signs of escalation of transmission, I think we do need to think about then how do we tighten up, on the, reduce the number of situations where people come into close contact. But I think the people of Ottawa are paying attention and they're holding things together. They're keeping things steady as she goes because we are still hanging out in the orange, close to red. To people's credit, this is what makes a difference. We're in orange because of people's behavior, and we could bring it down towards yellow. That would be great. But certainly holding it away from the red is a good goal for now. And I want to thank people. If you've heard that message to limit your close contacts, it makes a difference. So no, not today. I'm not saying let's go into red today before we cross a threshold, but I'm watching carefully.
Thank you. And a question on what we're seeing in terms of outbreaks. There seem to be a number of cases affecting hospitals and patients in hospitals. I'm wondering, have there been any discussions with the Ottawa Hospital or other hospitals in the region about what needs to be done to get a hold on spread in hospital wards?
Our outbreak team is in regular contact with the hospitals, and the hospitals have their own experts in infection prevention and control and infectious disease teams and physicians who are very collaborative with us. So, throughout the pandemic, it's required a lot of attention to personal protective equipment and the behaviors that limit transmission. And I know the hospitals are treating this very carefully and doing all they can to continue to bring things under control. They have the same challenges as anywhere when sometimes there are asymptomatic infections, and it's hard to be perfect all of the time, and so there's different work underway for sure to manage through the outbreaks and bring them back to zero.
Thank you, Craig. Nous allons maintenant à Julien Paquette avec le droit. Julien?
Bonjour. Je ne sais pas qui serait le mieux placé pour répondre à cette question-là, mais c'est quelque chose qu'on m'a beaucoup demandé depuis la semaine dernière, des lecteurs, en fait, qui se demandent, bon, quand il est question de la ligne téléphonique pour prendre rendez-vous pour un vaccin, vous nous avez dit la semaine passée, vous répétez aujourd'hui de téléphoner seulement si vous êtes éligible à recevoir le vaccin. Pour ce qui est des gens qui cherchent l'information, qui ne sont pas certains où ils sont situés, en ce moment, on parle de gens qui sont généralement plus âgés et qui sont peut-être moins confortables avec l'Internet et autres technologies. Est-ce qu'il y a un moyen de communication qui est disponible pour eux, un numéro de téléphone où ils peuvent appeler pour s'informer?
Donc, peut-être on peut commencer par s'assurer que les gens soient au courant de qui est actuellement éligible. Donc, dans les 21 communautés d'Ottawa, 80 ans et plus ont été identifiés. Donc, si vous n'avez pas 80 ans et plus, vous ne restez pas dans une des catégories, vous n'êtes actuellement pas éligible. À partir de mercredi, ceux qui ont 90 ans et plus, peu importe où ils sont dans la ville d'Ottawa, deviennent éligibles. En fait, la problématique que nous avons, c'est que on a décidé, on a pris une décision de s'avancer, si vous voulez, parce que c'est important de vacciner ces gens-là, même si le système provincial n'est pas encore en place. Il va y avoir, avec le système provincial, il va y avoir une ligne téléphonique, il va aussi y avoir un moyen via électroniquement de communiquer et avoir de l'information. Oui, il y a toujours moyen de vérifier au numéro, mais la problématique, c'est que si tout le monde appelle le numéro, c'est ce qu'on vit actuellement, bien qu'on a mis en place un système pour tenter d'avoir la capacité aux gens d'avoir un vaccin, on est comme limité. Donc, on suggère aux gens de plutôt aller au niveau du site web de santé publique d'Ottawa, mais comme vous dites, il y a des gens qui sont peut-être moins familiers avec ça, d'écouter les médias de savoir s'ils sont éligibles ou non. Et sinon, appeler le numéro, c'est une option, mais on demande aux gens de ne pas appeler le numéro nécessairement. Surtout au début, il va y avoir une demande accrue pour que les gens soient en mesure de réserver leur vaccination. Je ne sais pas si le docteur Etches elle a une idée mieux que moi, mais elle indique que non. C'est un peu une problématique. On savait qu'il y avait des éléments lorsqu'on poussait l'enveloppe un peu, mais on aime mieux être dans cette position-là que de ne pas avoir à faire du vaccin.
OK. Donc, si je résume, dans le fond, c'est une situation qui est temporaire et qui va être qui va être réglée quand le système provincial va entrer.
Effectivement. À partir du 15, ça va être réglé, il n'y aura plus de problème. Et pour les travailleurs de la santé, qui n'est pas votre question, on a un pré-enregistrement, mais c'est en ligne pour eux.
OK. Parfait. Puis ma deuxième question, ce serait pour le Dr. Etches concernant les indicateurs qui, si j'ai bien compris, vous me corrigerez, nous laissent entendre qu'on pourrait passer à la zone rouge très bientôt si la tendance se maintient. Donc, je voulais vous entendre un peu plus là-dessus, dans le fond. Est-ce que c'est à peu près certain qu'on va se retrouver en zone rouge bientôt ou il y a encore de l'espoir, encore du temps pour nous amener dans le bon chemin?
J'ai toujours l'espoir pour une amélioration dans le niveau de COVID-19 dans notre communauté. Et il y a les exemples auparavant où le peuple d'Ottawa a réduit le niveau de COVID-19 dans la communauté sans d'autres changements, juste par leur comportement. Et le niveau de COVID-19 dans l'eau usée, c'est vraiment haut. C'est comme le niveau après les fêtes en décembre. Mais peut-être aujourd'hui, il y a un peu, pas exactement, la courbe n'a pas tourné, mais ce n'est pas une grande augmentation encore. Et peut-être c'est quand les gens d'Ottawa entendent qu'il y a raison pour caution, de prendre caution, de faire attention aux angles morts. On peut changer la situation par limiter nos contacts étroits. Alors, j'ai l'espoir, on peut rester en orange comme ça, c'est près de rouge et habituellement, on va voir le taux d'infection augmente après l'eau usée, mais c'est possible d'aplatir la courbe encore.
Merci.
Merci, Julien. We will now go to Taylor Blewett at the Ottawa Citizen. Taylor?
Thanks so much. So I wanted to ask, first of all, at what point can we expect to see kind of behavioral guidance for fully vaccinated people? And will that be coming from OPH, or will that be coming from the province or from the Fed?
Thank you. I look forward to that day when the majority of our population is fully vaccinated with 2 doses of vaccine that's required for most of the COVID-19 vaccines, certainly all the ones we have today. We know in Canada our situation is a little different because we are going to proceed now according to the National Advisory Committee on Immunizations recommendations to double the number of people in Canada who have access to vaccination protection by extending the interval between the first and the second doses. And so that means, very good news for the population. More people will have that protection. But it means we won't all be fully vaccinated for a number of months. The interval will be extended, by about 4 months. So it is early days to be thinking about plans for when we're all fully vaccinated. But they are the province and at the pan-Canadian level, there are discussions about how do we start to adjust our frameworks, about thresholds, about what behaviors are permissible or advisable. And this is, the short term over the next 3 to 6 months, and then, beyond that. So the conversations are starting, but we certainly won't have that fully vaccinated picture with the 2 doses, for a while. I do want to encourage people, that it is worth proceeding in this direction to really note that first dose does provide high level protection, and the more people we can reach, the better.
Thanks so much. And is it just, this is kind of more of a clarification, but is it just those healthcare workers in the very high priority category who will be able to actually pre-register starting Wednesday? And when we talk about those in that category locally, does that include all of the sectors and settings that are listed under that category in the provincial guidance document? Just wanted to confirm that. I think I saw some groups like laboratory services maybe mentioned as in that group in the provincial document, but not in our local communication. So I just wanted to see if it was, considered exactly the same.
Well, thank you very much for that question, because that is what we're using. We are following the provincial guidance document. I have it in my hands here. The very high priority sectors and settings that are listed. That is who is eligible to pre-register starting this week. And it is, a self-identification process where people will self-identify that they work in one of these settings and that they're one of these patient-facing healthcare workers, either a regulated health professional or others who face patients and contribute to that care, including, reception, custodial, and security services. So that is exactly the guidance we are following, and that's what we'll use to proceed through creating that list and making sure people are vaccinated.
Thank you.
Thank you, Taylor. Nous allons maintenant à Samuel Blais-Gauthier avec Radio-Canada. Samuel?
Oui, bonjour. Donc, les joies de passer en dernier. Mes questions ont pas mal toutes été posées, mais j'aurais quand même des précisions à demander à Dr. Etches. Dr. Etches, vous avez laissé entendre qu'une 3e vague s'en venait. Ma première question, c'est est-ce qu'une 3e vague est imminente à Ottawa et qu'est-ce que ça représente, une 3e vague?
Je voudrais reconnaître que le travail des personnes qui habitent à Ottawa était vraiment efficace pendant cette pandémie. Le travail de limiter nos contacts, parce que notre expérience ici, c'est pas exactement une vague et après une 2e vague grande comme ça ou comme plus que le premier. C'était plus une série de plus petites vagues. Le 2e vague pour Ottawa, c'était un peu une courbe en juillet. Le 3e, c'était cet automne. Et maintenant, oui, on voit une autre augmentation, mais il y a aussi une en décembre Alors, pour nous, c'est comme le 5e et je voudrais féliciter la population pour ça parce que c'est meilleur d'avoir les petites vagues. C'est meilleur qu'une grande vague. Alors, je voudrais voir que nos comportements diminuent la taille de cette vague vite encore. Alors, l'indicateur dans l'eau usée, c'est grand, c'est une augmentation près de plus que le niveau en décembre. Mais peut-être aujourd'hui, ça change un peu. Ce n'est pas une grande augmentation encore. Peut-être c'est le début de diminution. Et c'est les actions, c'est quand on limite nos contacts étroits qu'on peut changer cette taux. Et on attend peut-être la situation où le taux de COVID dans la population qui a eu un dépistage augmente. Maintenant, c'est un peu stable. On reste stable dans la zone orange, mais c'est possible que ça va augmenter. C'est près de rouge parce que habituellement, ça suit l'indicateur dans la zone orange, mais c'est possible de réduire la quantité encore. Je pense que ça, c'est notre but jusqu'à nous avons la protection de la vaccin pour toute la population.
Docteur Etches, tantôt, vous avez souligné le fait que encore en ce moment, la moitié des nouveaux cas qui sont détectés proviennent de contacts étroits, de contacts de la communauté et des contacts dans les sports, comme ma collègue tout à l'heure l'avait mentionné. J'aimerais que vous m'en parliez un peu justement de ça, mais en français maintenant. Donc, qu'est-ce qu'on constate là, au niveau de la transmission là, en ce moment? Donc, c'est plus communautaire, des contacts étroits, c'est ça?
Oui, je pense, je comprends votre question. Le racine de la transmission de COVID-19, c'est quand on a le contact étroit et c'est vraiment les situations sociales, les situations dans la communauté, plus que dans les lieux de travail, par exemple, dans les entreprises ou les éclosions. Mais il y a des gens qui ont un dépistage positif pour COVID-19 qui travaillent dans beaucoup de différents secteurs, différentes entreprises. Alors, c'est un risque quand quelqu'un a des symptômes de COVID-19 et travaille avec les maladies, les symptômes peut-être pas trop sévères. On continue d'avoir une situation où c'est important d'être vigilant, de faire le dépistage pour déterminer l'évaluation, pour déterminer si quelqu'un a des symptômes avant qu'on travaille. Je ne sais pas si j'ai compris votre question complètement.
Ben, en fait, je voulais que vous nous parliez justement de ce qu'on a constaté, qu'encore une fois, la moitié de la transmission se fait vraiment par des contacts étroits et dans les sports. C'est ça que je comprends?
Ça, c'est un peu trop juste de limiter les sources aux les foyers où quelqu'un habite avec les personnes dans leur maison. Et juste le sport, il y a COVID-19 dans beaucoup de différentes situations. On a mentionné aujourd'hui les éclosions dans les hôpitaux. Il y a des éclosions dans les écoles. Il y a des éclosions dans les maisons de retraite, dans les entreprises. Ce n'est pas juste une source, mais oui, c'est presque une moitié qui est le COVID-19 est transmis dans le foyer ou la maison avec les personnes dans la même maison. Ça c'est comme ça pour presque toute la pandémie parce que c'est où nous sommes près aux autres. Nous avons le contact étroit, sans masque, sans distanciation. C'est où le COVID-19 est transmis.
Merci pour vos questions, Samuel. We will now move on to Sue sharing it on the City from the Blurbs. Sue, go ahead.
Thank you very much. So to Dr. Etches, I'm wondering if you have any more detail on, you spoke a lot about the people who are getting COVID, or you mentioned some sports groups. Do you have any more specific detail? And are these all people who aren't wearing masks, or is it more detailed than that?
So yes, I mean, usually when people are playing sports, they're not wearing masks. And where we're seeing the risk is also activities without masks before and after the games. So they would be situations where people are sharing a meal together, or they're carpooling together without masks. That is the behavior that allows COVID to be transmitted, because there's not that barrier stopping respiratory droplets from entering into somebody else's body and then causing infection. So we do encourage people when they're playing sports to keep distanced if they can, to make sure that they're not engaging in close contact before and after the games. If they're going to be traveling to games, to not travel together, except for people who live in the same household already. It's a wide variety of sports. We're seeing it in hockey, in soccer, in skating, in tennis, at dance schools. So you can see it's the nature of the activity that brings people close together. And sometimes with harder breathing when you're exercising, these are higher risk activities.
Thanks. And to Mr. DeMonte, is it time, I guess when I look at, the numbers, we'd all like to see them better. Is it time to use the heavy arm of bylaw?
We've used I think an approach that Dr. Etches keeps repeating, how pleased she is with the way this community has reacted. And I would tell you my perception and with regards to bylaw is that a couple of things. I think this community, because of the type of community we have, the workers who are able to work from home because of, government town in our high tech industry, that helps. I think they heed the leadership of Dr. Etches and her messages. And then I think the third component is bylaw and enforcement. And we've used enforcement not sparingly, but when it was necessary, and we continue to do that. I can tell you, Sue, on the weekend, we had a couple of bars that were not following the rules, that were going past the time. We're continuing to serve individuals, and we intervened following complaints. We intervened rapidly and with the appropriate response, and there will be charges. So we're not going to hesitate to do that because it puts everyone at risk. So I think it's a balanced approach, right? The leadership and message from Dr. Etches, the rest of the community answering, because I think Ottawa is just, we've done a great job, and then we're using bylaw as a tool. So I'm always afraid to use the heavy-handed kind of approach. We've got the tools, we use them when they're necessary, Sue, but it's like, I also understand that, enforcement is not a solution. We, each and every one of us, have to internalize that if we want this to work, we have to follow the public health rules. And if we don't, yeah, we're going to intervene when we see that, but it's not enforcement that's going to solve this problem.
Thanks a lot.
All right, thank you, Sue. This is all the time we have. C'est tout le temps que nous disposons aujourd'hui. Thank you. Merci.